Cefotaxime Solution, Reconstituted, Recon Soln, is a medication that is used to treat a wide range of bacterial infections. It can also be used to prevent infections after certain surgeries. This medication falls into the category of cephalosporin antibiotics, and it works by stopping the growth of bacteria. It is important to follow the dosage instructions provided by your healthcare professional. The dosage and length of treatment will depend on your medical condition and response to the treatment. It is typically administered by a healthcare professional through an injection into a vein or muscle. Make sure to take this medication at the same time each day to maintain a consistent level in your body and to get the most benefit from it. It is important to continue taking this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. When using Cefotaxime Solution, Reconstituted, Recon Soln, it is important to follow your doctor's instructions for injection into a muscle or vein. If injecting into a vein, it should be done slowly over at least 3 minutes to avoid possible serious side effects. The dosage will be based on your medical condition and response to treatment. If using this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. It's also important to learn how to store and discard medical supplies safely. If using the frozen premixed solution, thaw the bag at room temperature or in the refrigerator. After thawing, shake well and squeeze the bag to check for leaks. Do not refreeze the solution after thawing. To get the best effect, use this antibiotic at evenly spaced times. It's helpful to use this medication at the same times every day. Make sure to continue using this medication for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition lasts or gets worse, be sure to tell your doctor. If you experience swelling, redness, or pain at the injection site, it's important to let your doctor or pharmacist know promptly. However, many people using this medication do not have serious side effects. It's important to monitor for serious side effects such as easy bruising/bleeding, unusual tiredness, uncontrollable movements, mental/mood changes, seizures, signs of kidney or liver problems, and fast/slow/irregular heartbeat. Additionally, be aware of the possibility of a severe intestinal condition and contact your doctor if you develop symptoms such as persistent diarrhea, abdominal/stomach pain, or blood/mucus in your stool. Prolonged or repeated use of this medication may result in oral thrush or a new yeast infection, so it's important to contact your doctor if you notice any changes in your mouth or vaginal discharge. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Before using cefotaxime, it's important to let your doctor or pharmacist know if you have any allergies to this medication or other antibiotics. This is because cefotaxime may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have kidney disease or stomach/intestinal diseases. It's important to note that cefotaxime may affect the effectiveness of live bacterial vaccines, such as the typhoid vaccine. If you are planning to have any immunizations or vaccinations, make sure to inform your healthcare professional that you are using cefotaxime. Before undergoing any surgical procedures, be sure to inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss with your doctor before using cefotaxime. Additionally, if you are breastfeeding, consult your doctor before using this medication, as it may pass into breast milk in small amounts. When taking Cefotaxime Solution, Reconstituted, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. It's important to inform lab personnel and all your doctors that you are using this drug to ensure accurate test results. If you or someone else has taken too much cefotaxime solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical assistance. In the US, you can call 911 for emergency help or reach out to the local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center for assistance. Symptoms of an overdose may include seizures. It is important not to share this medication with others as it is prescribed specifically for you based on your medical condition. While using this medication, it is important to undergo lab and/or medical tests such as complete blood count and kidney function tests. It is crucial to keep all medical and lab appointments to monitor your progress and any potential side effects. Make sure to take each dose of cefotaxime solution as prescribed by your healthcare provider. If you happen to miss a dose, consult with your doctor or pharmacist for guidance on when to take the next dose. It is important not to take a double dose to make up for the missed one. Be sure to follow the product instructions and consult with your pharmacist about the proper way to store cefotaxime solution, reconstituted. Keep all medications out of reach of children and pets. Do not dispose of medications in the toilet or drain unless directed to do so. When the product is expired or no longer needed, be sure to discard it properly. Consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.